Hello and welcome to the blood transfusion module. My name is Saba Iqbal and I'm the transfusion practitioner at Walsall Manor Hospitals. It may be a good idea to have your mobile phone on hand to scan some of the QR codes throughout this presentation, which contain some helpful resources. So these are some of the topics that will be covered in this module. We will go through each step of blood transfusion from taking group and save all the way to blood administration. We will also be covering the major hemorrhage protocol, transfusion reactions, and going through step by step on how to request a group and save and any blood products or components on fusion. So there is only one blood bank collection fridge in the entire hospital at Walsall, and that is located in route 021. For blood bank extension, the number is 6472 if you need to contact blood bank laboratory, and the bleep number is 5095. We will go through what a blood component is and what a blood product is, and which one of these are actually kept in blood bank and can be issued from blood bank as well. So first of all, blood component includes red cells, platelets, fresh frozen plasma, FFP, cryoprecipitate, or white cells, which are also known as granulocytes. In terms of blood products, we stock albumin, prothrombin complex, which is PCC. We also stock anti-D, Novo7, which is recombinant factor 7, and Octoplas as well. So I'll go through the blood products and components to give you some more details for each product or component that can be requested from blood bank. So first of all, we have red cells, which are stored at 2 to 6 degrees Celsius. They are kept in a blood stock fridge or the blood collection fridge. They must never be kept in any other fridge or any drugs fridge on the ward. Transfusion must commence as soon as a unit reaches a ward and completed within 4 hours from leaving the temperature control storage. We use blood track for the cold chain, so we know exactly how long the unit has been out of temperature outside of the fridge. And we can also monitor who has collected the unit or returned the unit back to us as well. The transfusion rate must be 2 to 3 hours for red cells, and one unit gives approximately 10 grams per litre rise in HB. Platelets, these are kept at room temperature, so at 22 degrees Celsius plus or minus 2. And they're kept in a platelet agitator in blood bank, which continuously agitates the platelets. Blood bank do not keep any stock of platelets, so they must be ordered and issued on a named patient basis. They must be transfused as soon as it reaches a clinical area, so please keep in mind that if your patient does need platelets, blood bank will need enough time to order these from Birmingham and be able to issue them and have them ready for your patient. Next is fresh frozen plasma, which is FFP. So this is kept frozen, and once stored, it's kept at the same temperature as red cells, so that's 2 to 6 degrees. It must also be stored only in a blood collection fridge after being thawed, and never in any other fridge. It must be transfused as soon as it reaches a clinical area. FFP contains coagulant factors. It's used in multiple clotting factor deficiencies, and in a major hemorrhage protocol, which we will cover later on in this presentation, it must be given at a ratio of 1:1. And one dose is usually 15 mL per kilogram of the patient. Next, we have cryoprecipitate, which looks very familiar to fresh frozen plasma. It is also kept frozen in storage, but once thawed, it's kept at room temperature. So that's the main difference between fresh frozen plasma and cryoprecipitate. So even though both of them are frozen, one is kept at room temperature and the other one is kept at the same temperature as red cells. So after cryoprecipitate has been thawed, it is also stored in blood bank at room temperature, must never be stored in a fridge, and it must be used 4 hours after thawing. It must be transfused as soon as it reaches clinical area, and cryoprecipitate is rich in factor 8 and fibrinogen. Next, we have blood component albumin. This is kept at room temperature as well. It's stored in blood bank, and it must be returned to blood bank within the 24 hours if it is not being used. Please do not store albumin in any cupboards on wards for several days. Please only take or collect as many albumin bottles as you need from blood bank. Do not collect more than you need. The next one is Octoplex PCC. So that's also kept from 2 to 25 degrees. It's kept in blood bank stock fridge. The dose is specific to the weight of the patient. It is reconstituted before, as per the instructions inside the box, and it's used for warfarin reversal. It must be authorised by a consultant haematologist before being used for any patient. Anti-D is kept in the blood bank stock fridge and it is given following potentially sensitising events. Blood bank only store 1,500 international units of anti-D, and this usually covers up to 12 ml bleed. It should be administered as soon as possible and always within the 72 hours of the event, and it is given to pregnant women who are rhesus D negative. We also have recombinant factor 7, or known as Nova 7. Again, it's kept in blood bank. It must be authorised by a consultant haematologist, and it's reconstituted before use as per the instructions given in the box. And finally, we have Octoplas. It is a batch product. It is pooled human plasma indicated for replacement of multiple coagulation factors in patients with acquired deficiencies due to liver disease or undergoing cardiac surgery or liver transplantation. It's used for plasma exchange in patients with a TCP, and once it's stored, it must be refrigerated as well. So this is the Blood Components app. So if you want to scan the QR codes for Apple or Android, and it is designed by the NHSBT to guide healthcare professionals in the safe and appropriate use of blood components, and it is also based on the UK Transfusion guidelines. It's a very useful app to give further details at the bedside without having to search a full guideline, and it also covers the NBTC indication codes, so it's a very useful app to have on your phone. So this is the 10 steps in transfusion, and this is taken from the SHOT website. So we will go through each and every step, and I've covered most of these in this presentation as well. So the first one is obviously to decide that your patient needs a transfusion and to gain patient consent. Informed consent is very important when it comes to a blood transfusion, and we will cover that shortly in the next few slides. We will also be covering how to request a group and save and blood product for your patient, and how to take a sample as well for a group and save. Points 4 to 7 are points that are done in the lab. So the sample and request receipt. So once the sample has been received by the lab with the relevant request, it is then booked in, and it's then tested using analyzers in the lab for a group and antibody screen. Further testing for antibody ID, if necessary, is also taken place in the blood bank laboratory. If for whatever reason blood bank cannot identify the antibody, they will send the sample to RCI lab in Birmingham, which is a reference laboratory, and in order to identify what the antibody is. They will then select the relevant components for your patient, so red cells, for example, and then test it for compatibility. So they'll do a cross match and only issue compatible units. They will then label up the components with the patient details, and then it will be ready in the blood bank fridge for collection. So number 8 is component collection. So blood collection training, which is a PA2 blood collection training, is delivered face to face. And it's by myself. So CSWs or nurses are blood collection trained. They will come to collect the blood component, and then the prescription and authorization. So the blood component needs to be prescribed before collection, which we'll go on to next. And then the last point is administration and monitoring for any transfusion reactions. Again, we will cover this in the presentation as well. So this is a picture of the blood products transfusion record. This is the form that we use to prescribe any blood products for a patient. On here, on the top left, you will have patient details. You can use a sticky label for this part, but you must make sure that it matches the patient's wristband. This PTR is what is used to collect blood products as well. So it's very important that you fill out all the details on here and they are filled out correctly. Here you will put the doctors who's prescribing the product, so their details will go here. On here you'll put the date of transfusion and what it is that has been prescribed and the rate. So for example, red cells, and the rate that they should be transfused is 3 hours. You have this box here, which is to remind you of the bedside checks. So it's very important you positively identify your patient, to ask your patient to confirm their patient details, and also note down your informed consent to make sure that consent has been given by the patient. So one is verbal consent, and the other way you can also provide informed consent is by providing a leaflet of will I need a blood transfusion. So now we will go through how to request a group and save and components. So you will log on to Fusion and search for the patient. Once you've got the correct patient, you click on this ICE button here. You then select specialty and then scroll down to transfusion services, which is this yellow box here. As you can see, there are 3 options: group and screen, platelets with no GS, which means no group and save, or red blood cells with no group and save. So when you are requesting blood products or components, we only need a valid group and save when you need red blood cells. For albumin or for anti-D, we do not need a valid group and save, so we do not need a sample in blood bank. So once you click on the group and screen button, this pop-up box will appear to remind you to print off the request forms to send to the lab with the sample. It's also very important that you print off the request form for a group and screen before the sample is taken from the patient as well. So we will go through how to request blood components such as red cells during this presentation. This box will pop up on your screen asking you if you need any blood products. Please click yes if blood products or components are required, or no if it is only a group and antibody screen sample that you would like to send to blood bank. For platelets, we do not need a new sample every time. We just need a historical confirmed group for platelets. We will also go through this presentation later on how to request albumin, which does not require a group and screen sample either. So a pop-up box will appear asking a series of questions which will populate the request form, and this is information that is needed by blood bank. So we will go through each question asked. So the first one is patient consent. So have you received informed consent from the patient? So these leaflets are available, which should be handed out to the patients or their family members or carers, which gives a lot of information on what to expect in a blood transfusion and why they need a blood transfusion as well. The My Transfusion app, again, it's free to download. Please do scan these QR codes. It's an informative app and it's designed to educate and support patients receiving a blood transfusion, and it helps them feel that they are part of their care. And it offers a clear explanation to the transfusion process and helps them make an informed decision as well. So the next question is whether or not a TACO risk assessment has been carried out for a patient and if the patient is at risk of TACO. So first of all, what is a TACO? TACO is a transfusion-associated circulatory overload, and a TACO risk assessment must be carried out for each and every blood unit that is transfused. So TACO is one of the most common causes of transfusion-related deaths in the UK. And the cases that have been reported have increased in recent years as well. They are potentially preventable if all the right checks have taken place before transfusion, and it can occur in any individual at any age. TACO is defined as acute or worsening respiratory compromise, or acute or worsening pulmonary edema during or up to 12 hours of transfusion, with additional features including cardiovascular system changes not explained by the patient's underlying medical condition. The risk of TACO is increased by low body weight, renal or cardiac dysfunction, pre-existing fluid overload, or a high volume of red cells being transfused in relation to the body weight. Some of the symptoms of TACO include shortness of breath, chest pain or discomfort, swelling of the legs, ankles, and the neck due to fluid retention, dizziness, headaches, and fainting as well. Patients that are high risk include elderly patients or older adults, infants or individuals with heart failure, kidney disease, or liver disease, and patients who receive multiple transfusions as well. So if your patient is at risk of TACO, this form here is taken from SHOT, and this is a TACO risk assessment which must be done before each and every unit is given. So SHOT, which is Serious Hazards of Transfusion, is a UK independent professionally led haemovigilance scheme. They collect and analyse information on adverse events and reactions of blood transfusion from all healthcare organisations that are involved in transfusions of blood, and they also produce a report every year. So this data here for TACO has been taken from the most recent report on the right-hand side. And as you can see, the most recent SHOT report shows that morbidity has increased by more than 50% compared to 2023. There were 31 deaths as a result of TACO, hence why it is very important to find the cause of anemia, and carrying out a TACO risk assessment before transfusion is essential. SHOT have also produced a new TACO anemia management resource, which you can see on the left-hand side. And it is to identify the cause of anemia in individuals with severe chronic anemia and protect the patients from the risk of TACO as well. So this flowchart provides guidance on how to treat patients with chronic anemia and how many units should be considered to avoid any further complications related to TACO. So the next question is, has the patient had a previous transfusion reaction? So obviously looking at patient notes, you'd answer that question. The next question is the reason for red cells. So we use the national indication code, so the MBTC indication code for transfusion. If you scan this QR code here, it will take you onto the most up-to-date indication codes for transfusion for red cells, FFP, platelets, etc. So from this drop-down box, you would choose which best describes the reason for transfusion for this patient. So is it acute blood loss? Is it because they've got a cardiac disease and HB less than 80? Or is it for an exchange transfusion, etc.? So please do scan that QR code if you want to have access to the most up-to-date indication codes for transfusion, as the up-to-date ones have not been updated on Fusion as of yet, but they will be in the near future. So any blood components or products that are issued from blood bank are given 24 hours before they are de-reserved. So please fill out the date and time they are required correctly, because we will give them 24 hours from that date and time. Once those 24 hours have gone past, we will then return those units back to stock. So please do make sure you give us the correct date and time the blood product is required. If we do not have the red cells or the platelets, for example, in stock, we will have to order them in. So please do make sure that you give us the right time, date and time required, so we can make sure they are ordered in for when the patient needs them. Please also provide us with your contact information in case we need to ask you any further questions, or if we need to let you know if there is a delay. So the next box is to indicate how many units are required for your patient. Please only do a single unit blood transfusion before checking the hemoglobin by sending a full blood count sample to hematology, and then deciding whether or not your patient needs a second unit. This will also reduce the risk of TACO. It will also save stock levels of blood, and it's also good practice for patient blood management. Please also scan the QR code. It is a link to a quick reference guide to all clinical resources for patient blood management. And it also will cover things like iron infusion instead of giving a blood transfusion. So for patients with iron deficiency anemia, they will probably benefit from oral IV iron instead of a blood transfusion. And also giving tranexamic acid to patients, particularly in surgical settings, which obviously will also reduce the risk of TACO and TACO-related deaths as well. So very quickly, we'll go through special requirements for red cells. So this includes irradiated, which is irradiated red cells are provided by blood bank, and they have been treated with radiation, such as X-ray or other forms of radioactivity, and it prevents transfusion-associated graft versus host disease, and it's used for patients who are on chemotherapy or have Hodgkin's disease or purine analogues such as daratumumab. So if you do require irradiated products for your patient, please indicate that you need irradiated red cells. Other special requirements include CMV negative, which is automatically given from the blood bank to all pregnant ladies. They receive CMV negative blood. Any neonates and infants up to the age of 1, if they have an exchange transfusion or IUT, which is an intrauterine transfusion, they will also receive CMV negative blood from the lab. If you require HLA matched platelets, which is for for patients with alloimmune platelet refractoriness, they require 24 hours notice minimum, which need to be ordered from the NHSBT lab. Please let us know if anyone does require HLA matched platelets as well. We will also provide HBS neg blood for sickle cell patients, so hemoglobin S negative blood for sickle cell patients, but please do make blood bank aware if your patient has sickle cell anemia. So now we will go on to a group and screen sample. So a group and screen sample is sent to blood bank to test for patient's blood and the RHD status. So for example, A positive, and the antibody screen status as well, whether that's positive or negative. If the antibody screen is positive, blood bank will do further tests to identify the antibody. If the antibody cannot be identified by blood bank lab, they will send it to the reference laboratory in Birmingham. The sample is also used to test for compatible blood units, so to carry out a cross-match for patients that require a blood transfusion. Blood bank has a zero tolerance policy and will reject samples if details on the sample and the request form are not correctly filled out or are incomplete. So it's very important that all spellings are correct and they match the details that is on the request form. All group and antibody screen samples must be handwritten. And no sticky labels or pre-printed labels are allowed on the sample, and this will result in a sample rejection. So how to collect a sample for a group and antibody screen. This is an example of a request form which must be printed out before collecting the group and save sample. The patient details will be printed onto the request form. Obviously, they've been anonymized on this case, including all details that were entered onto ICE. The request form must always be printed and physically taken to the patient's bedside before the sample is collected. The request form must also be checked against the patient's wristband, and you must ask the patient to confirm their details. Please don't ask the patient, "Are you John Smith?" Please ask them to confirm or tell you what their name and date of birth is. Request form must also be signed by the person taking the sample, and the date and time on the form must match what is the date and time on the sample as well. So the information that is required on the sample bottle includes the first name, the surname, NHS number or the patient hospital number, the date of birth, the date and time the sample has been taken, and the signature of the clinician collecting the sample. And this must all match what is on the request form as well. It must be filled out correctly in clear handwriting, and the spellings must also be correct. Failure to complete any of these on the sample will result in sample rejection. So if any of these details are missing, blood bank will reject your sample. Please always label the sample at the patient's bedside with the request form in hand as well. Please never pre-label sample bottles, never use pre-printed labels on sample tubes, and never allow another person to label your sample. So we're just going to run through the 2 sample rule. So if a patient has never had a group and antibody screen taken before, it's important that we receive 2 samples taken at 2 different occasions. Please do not take the 2 samples at the same time. It defeats the purpose of the 2 sample rule and can result in a wrong blood in tube. If the patient is less than 4 months old, then only 1 sample is required. If the patient has been bled at a different hospital outside of the area, for example at Heartlands or at the QE, blood bank at Walsall Manor cannot see this information, so we would require 2 samples to be taken for a patient. So these 2 samples must be taken separately, preferably by 2 different people. If not, 30 minutes apart. If the patient has been tested previously for a group and antibody screen, then only one sample is required. Please do not take the 2 samples at the same time. I need to reiterate this. We have lots of incidents where members of staff are taking 2 samples at the same time and they've bled the wrong patients, which can result in ABO incompatibility, and it can result in death as well. So please do not take 2 samples at the same time. Please take samples separately on 2 different occasions, 30 minutes apart. So what is wrong blood in tube? So wrong blood in tube, or WBIT, is when the blood that is inside the sample bottle does not belong to the patient details that are written on the bottle itself or the request form. So for example, if a sample is bled from the intended patient and labelled with the wrong patient details, or the wrong patient has been bled but labelled with the intended patient details. The 2 sample rule confirms the correct patient group to avoid any ABO incompatibility and severe harm to the patient. All WBIT incidents are reported on Datex and are reported to serious hazards of transfusion, which is SHOT. So this data is taken from the most recent SHOT reports, and as you can see, the primary errors leading to WBITs or wrong blood in tubes in 2024, with 41% was patients not being identified correctly at the bedside or at phlebotomy when taking the sample. And 31% of these were when the sample was not being labelled next to the patient. So it's very important that we positively identify our patient, we confirm all the patient details, we check the wristband, we have the request form printed off before taking the sample so we can check the details. And it's also crucial that the correct procedures are followed when taking a sample from a patient for a group and save. All WBIT incidents, like I said before, are Datex are reported to SHOT as well. And it's important that we don't take 2 samples at the same time. So once we have 2 samples on file, sample validity is how long the sample is valid for. So in women who are pregnant, patients who are transfused in the last 3 months, or patients with a positive antibody screen, their sample will be valid for 3 days. A patient who are transfused more than 3 months ago and they have a negative antibody screen, their sample is valid for 1 week. It's important to understand that blood banks do not require a sample every day, or we do not require a sample with every request. Hence why it's important to know if the sample is valid for 3 days or for 1 week. If you are unsure, you can always check on Fusion, or you can call blood bank to confirm if we need another sample. So we will go through how to request batch products, which is albumin or any factors, for example, or anti-D. So to request batch products, we do not need a sample for this. You need to click on batch products, as you can see here, and then click on the product that you need. So for example, if you needed albumin 20%. The pop-up box will then appear and ask for how many number of units you need. So this is the number of bottles. So albumin comes at 5% and 20%, and they're both 100 ml each. So you can indicate how many bottles you need here and when it is needed for, so the date and time as well. The form needs to be printed off and sent to blood bank either through the pod or by hand. A blood bank will then issue the number of bottles that you need. So this brings us on to blood administration. So when administering any blood products or components, ensure all the patient details are correct by checking the patient's wristband against the traceability label that is attached onto any blood units or components. All checks are carried out by 2 registered healthcare professionals. The check must not be carried out together, it must be done individually. Observations must also be done up to 1 hour before the transfusion commences. Once the transfusion has started, 15 minutes into the transfusion, observations must also be done and at the end of the transfusion as well. So the observations include the pulse, the blood pressure, the patient's temperature, respiratory rate, and oxygen saturation as well. So this is what the traceability label looks like. This will be attached to any blood product or components that you collect from blood bank. The blue square contains obviously the patient details, so that would be the surname, the first name, the date of birth, the hospital number or the NHS number. It also includes the donation number of the blood unit or component. And these are the details that should be checked against the wristband. So as you can see here, the surname, the full name, the date of birth and the hospital number must be checked with the wristband of the patient. Always involve the patient when asking them to state the name and the date of birth where it is possible. The blue square, like I said, is all the patient details. The green square is actually a detachable part of the label, and that is for traceability. So traceability data is kept up to 30 years. It is a legal requirement by the Blood Safety and Quality Regulations Act 2005 and is also regulated by the MHRA. It's very important that we have 100% traceability for each and every unit that is taken from blood bank. So we need to know exactly where that donation has come from and which patient it is being transfused into. So traceability is actually done on BloodTrack. However, if BloodTrack is not available, please detach this green label, sign and date at the bottom of this as a declaration to confirm if the unit has been used or wasted, and please send it back to blood bank for traceability. It's very important that we have 100% traceability for every unit and that everyone participates in traceability as well. So please make yourself familiar with BloodTrack when you get onto the wards, and also if BloodTrack is not available, please send the green label part back to blood bank. So once a blood component has been collected, you have the 30-minute rule. So blood components not being transfused must be returned to blood bank within 30 minutes. If more than one unit is required, so for example in a major hemorrhage, then the units must be taken in a cool box, which is a red box over here. So if you are taking a blood unit back onto the ward and for whatever reason the patient has refused to have the blood or you've decided against the transfusion, please send the blood unit back as soon as possible back to blood bank, and you have up to 30 minutes to decide whether or not you're going to transfuse that unit. Units taken in a blood cool box, if it's a closed cool box and if it remains closed, it is valid for up to 2 hours. So the blood units can stay in the cool box for 2 hours as long as the seal is not broken and it is closed. As soon as that cool box is open, we revert back to the 30-minute rule. You have 30 minutes to decide if the blood will be transfused or not, and then you need to send everything back to blood bank. If you are not going to be using any products, please send them back as soon as possible, so we can decide if we need to waste the unit or if we can use a unit again for somebody else. So a major hemorrhage is when there is significant bleeding or there is blood loss of 150 mils per minute or a blood loss of a litre with hemodynamic instability. So the major hemorrhage protocol is activated by calling blood bank directly on 6472. It's very important when you call blood bank you declare that you're activating a major hemorrhage. Blood bank will then ask you for some details of the patient and what ward you're calling from, etc. It's very important that you identify the designated runner. So the runner will be the member of staff. It can be any member of staff who will be running to blood bank and take samples with them to collect this red cool box, which will include red cells and FFP if needed. And the runner will then bring back this cool box to the clinical area as quickly as possible. So it's important you identify the person who will be the communication lead and the person who will be the runner. The communication lead will be the person on the phone who will communicate between blood bank and the clinical team. And communication is key in a major hemorrhage protocol in order to have a successful MHP activation. So this is a copy of the major hemorrhage poster, which has been printed off and distributed to clinical areas around the hospital. Please familiarise yourself with this poster and locate the poster on your wards wherever you are working. So as you can see, it tells you how to activate the major hemorrhage. It also tells you what is included in pack 1 and pack 2 given by blood bank. So in pack 1 we will give you 2 red cell units. If you require FFP, please let us know because we do need to thaw this out and it takes approximately 25 minutes. We will give you red cells first and then the runner will have to come back for the FFP if they need it. We will then give you pack 2, which includes 4 red cell units, 2 FFP, and some platelets and cryo, again, if you need it as well. If you do not need the platelets or the cryo, or if you just need red cells, please do let blood bank know and keep the communication consistent with blood bank and clear. If you do stand down the major hemorrhage, please inform the lab as well and return any unused products or components, including the red cool boxes, to blood bank. And please also return any traceability labels, ensuring that they are correctly filled out back to blood bank as well for the sake of traceability. So if you are suspecting a transfusion reaction in a patient, please stop the transfusion as soon as you suspect it. Do not continue with that transfusion until all observations are done and you've assessed and managed the patient correctly. So you would assess the patient by carrying out the observations again, includes the temperature, the pulse, the blood pressure, etc. The symptoms of a transfusion reaction include a temperature rise of more than 2 degrees Celsius, or if the temperature rises above 39 degrees Celsius. Other symptoms include fever, rigors and chills, any pain, tachycardia, hypertension, or if the patient is in distress or feels unwell, please stop the transfusion. You need to discuss the treatment with a haematology consultant or with a senior member of staff, and you must inform blood bank as soon as possible to complete any documentation. All transfusion reactions are reported to SHOT, and they must be reported to transfusion. So this flow diagram has been taken from the BSH guidelines for transfusion reactions. This QR code, please do scan this QR code. It is the BSH guidelines on the investigation and management of acute transfusion reactions. For more details, if you want to know more about transfusion reactions and how to deal with them, please do scan this QR code. You'll find a vast amount of information on that. Any serious transfusion reactions or severe transfusion reactions are reported to SHOT, like I said before. But yes, please do use this flow diagram for more information. So this finally brings us on to the Blood Assist app. Please scan the QR codes and download this app. It's very informative. It's developed by the PBM team, which is a patient blood management team, and the NHSBT. Incorporates all the guidance and recommendations from the BSH guidelines and from SHOT as well. And it is intended for use for all trained and registered healthcare professionals. There is a web version as well if you wanted to access this on the internet. It's bloodissist.co.uk. The app includes information regarding TACO risk assessment, special requirements. There's information on patient consent and guidance on transfusion reactions. It also includes a helpful tool on blood component compatibility as well. So please do download this app. It's very helpful, very informative. So that brings us on to the end of this module. These are my contact details. My extension number is 6252. Please take note of my email address. If you need any further information or a copy of this module or any further training, please do contact me, or you can contact Blood Bank on extension 6472. Thank you so much for listening and for your time, and best of luck.